Scoliosis is a spinal deformity. It is essentially a three-plane deformity where your spine is bent to either side, either right or left, and not only it is bent to one side, it is also rotated. So normally people say that scoliosis may you bend over to one side. That is part of the problem. The major part is that your vertebral bodies, they are rotated. So there is uneven bending, there is rotation, and the part of your body is protruding back or protruding in the front. So, in nutshell, the scoliosis is a three-dimensional deformity of the spine which affects the bones, muscles, and the nerves and leads to uneven presentation of shoulders, hips, pelvis, with one shoulder being up and one shoulder being down. There are essentially four types of scoliosis. Number one, and the most common, is idiopathic scoliosis, which is more than 90% of our cases. So this affects girls more than boys, and it usually presents between 8 and 9 years to about 14 to 15 years of age. Like the name suggests, it is an idiopathic scoliosis. Exact reason is unknown. But now the latest research that tells us that it is the pool of genes which you get from your father, your mother, that decides whether you will get scoliosis or not. Second type of scoliosis is neuromuscular scoliosis, where there is some syndromic problem, some nervous system problem, where the muscles on one side of body are not exactly working as good as on the other side. This can happen in the patient with cerebral palsy, for example. So with the muscle imbalance, body tends to tilt over to the one side, and these patients can have a severe scoliosis. Number three is a congenital scoliosis, and as the name suggests, you are born with it. This usually happens when there is a formation defect or a segmentation defect of the vertebra, which means your vertebrae are either partially formed or they are not completely square. Some of them are triangle shape or some of them are a butterfly shape. This leads to the bending of his spine depending upon the shape of that partially formed vertebra. And last is an adult scoliosis or a degenerative scoliosis, which usually happens after 45 to 50 years of age. This happens because of asymmetric disc degeneration, and that can lead to a tilting of spine in one direction or the other. Scoliosis is not just a cosmetic problem. So patients would usually come with the issues like from behind, my one shoulder is up or my upper part of the body is tilting onto the other side. There's an asymmetric waistline. When you stand straight, my one hand stands closer to my body, other hand is away from my body. There may be an uneven height of the hips. One hip is higher than the other. When you bend forward, when you see it from behind and the patient being bent forward, you will see an asymmetric chest rotation where one part of chest is protruding upwards and outwards. That is called as an Adams forward bending test. In the severe cases, this can lead to asymmetry of the pelvis, which can lead to a limb length discrepancy. And when you're walking not in straight line. You are basically bent over and walking. So this is the common presentation with which patient would present to you. Scoliosis, like I said, is a three-dimensional deformity. The spine is not just bent in one direction, but is also rotated. Now, example, just imagine your thoracic spine, your middle part of the spine has got ribs attached to it. So now ribs are attached to it and it is rotating, not just bending. So when it rotates, so one part of the ribs protrudes outwards, where other part of the ribs, they protrude in the front. So when you bend forward, the part that is protruding outwards stands out. So it feels like some part of the ribs are standing out. This standing out of the ribs is basically called as a rib hump. Again, because of scoliosis and three-dimensional rotation of the vertebra, this happens. In most of the instances, scoliosis is idiopathic, which was initially considered that there is no obvious cause. But the latest research that tells us that it is a genetic thing that leads to a scoliosis. There are pool of genes which are present in your father and in your mother. If you get both the pools from your father and mother, then that means you are predisposed to get scoliosis. These genes work in a way that when you are into your growth spurt, say between the age 8 or 9 to about 14 or 15, then you get the scoliosis. Apart from this, there can be a congenital scoliosis. Then that means that you are born with some sort of a defect in your vertebra, which may be partially formed or partially segmented. Number third would be a neuromuscular or syndromic. That's a part of a whole body that's involved in certain diseases, including spine, and that leads to a scoliosis. Or there is a nervous system involvement, which leads to a muscular imbalance, like in cerebral palsy, and that can lead to a scoliosis. Early diagnosis or early detection of scoliosis is of paramount importance. There is no doubt. So when you diagnose the curve which is less than 20 to 25 degrees, then you can actually control the scoliosis with exercises and braces. You do certain tests like forward bending, Adams forward bending test, which will lead to an asymmetry of the posterior chest that can point out that there's some sort of a scoliosis. Subtle signs like one shoulder is above the other, one hip is slightly prominent than the other, the waist is asymmetrical. One side of the waist is going inside of it, while the other side is pointing outside, or limb length discrepancy. One leg is shorter than the other. So these are the pointers when there is no proper curve of the back, but patient can make out that something is not right. To confirm the diagnosis, you usually do an X-ray of the whole spine on 3 feet film to see your spine from the top of your neck till about your pelvis area, so that you can see exactly if there's any curve there. That is how we make a final diagnosis. We usually measure scoliosis in the form of an angle, that is the most tilted vertebra in the direction of a curve. So when this angle is more than 10 degrees, then only we call it a scoliosis. So when you present early, say for example, the curve is between 10 and 25 degrees, then you usually tell them to monitor. We need a serial X-rays, 6 monthly or 1 yearly, depending upon what is the size of the curve, and do a stretching exercises, physiotherapy and physical therapy. When the curve is between 25 to about 40 degrees, then we need to monitor them slightly more regularly. And we also start a bracing. When I say bracing, we tie some sort of a brace around their chest and waist to cover the whole back. Most common type that we use is a Boston brace. And this tends to stop the progression of the curve. And once the curve is stopped growing, then you can remove the brace. The brace should be worn about 18 to 23 hours a day. As long as you can wear, that is better. When the curve is more than 45 to 50 degrees, then unfortunately we are looking for a surgery to prevent the further complications, because once curve reaches 85, 90 degrees, then there can be some complications. So you don't want to reach that stage. Around 40, 45 degree, if it is already more than 50 degrees, then surgery is advised. Early stages, early detection, less than 20-25 degrees of the curve, you can completely cure scoliosis. In between, yes, again, you need a brace therapy. If it corrects, then you don't need anything. If it progresses, then if it crosses 50 degrees, then you might need surgery. But with surgery, it is completely curable. You can make patients' spine straight, you can prevent complications, and the surgery is required only if the curve is more than 50 degrees. When curve is less than 40 degrees or 35 degrees, then lifestyle changes, use of a brace, exercises or where bending onto the opposite direction, stretching of your back, these can help in maintaining the curve and not letting it progress. But the dictum says when it is more than 50 degrees, it will be progressing by 1 degree per year at least. So early stages, early detection is important to prevent it from reaching a stage where you need a surgery. The scoliosis we measure with the help of a curve, that is a Cobb's angle, which is the angle that is found by the most tilted vertebra into the curve. So when angle is about 85 degrees or more, then especially in the early growing phase, so this can lead to a insufficiency of the lungs. Your lungs may not grow as much as they should grow. This can lead to respiratory problems in the long run. And when the curve reaches more than 100 degrees, then this puts pressure on your intestines. The child may not eat adequate food because his intestines are compressed because of the curve. This can also lead to a growth retardation, or there is a problem with the development of the child. When this curve reaches the extreme state, say around 120 degrees or so, then there can be asymmetry of the pelvis. One leg might appear bigger and one leg shorter, so there's difficulty in the walking. And this can, in the severe stages, can also lead to a neurological problems with extreme size of the curve, say more than 120 degrees or so. Apart from this, the scoliosis has also got a lot of stigma. Stigma not only because of your appearance, but also your mental well-being. People, they tend to develop some psychological symptoms. They tend to be timid. They tend to remain within themselves, and they are not able to express because they feel that people would comment on their appearance. So the psychological aspect of scoliosis is also very important. First thing is, we as a society need to start some screening programs so as to have an early detection of the scoliosis so that we can avoid the extreme stages. So most of the Western countries, they have a school screening program which start at when you are in 7, 8 years old and can continue up to 13, 14 years of old. That is the most common presentation. So people, I would just ask them to be more aware of this thing and to consult a specialist, maybe a spine consultant, maybe your physician. Once you have a doubt that, one shoulder is above or one shoulder is below, your hips are not exactly symmetrical, one is higher, one is out, your waist is not symmetrical, or your limb lengths are not symmetrical. So these are the subtle appearance changes that can happen before the full-fledged scoliosis is seen. So once you see the early changes, you meet your physician, you meet your general practitioner, or you meet your spine specialist to discuss if this is actually a scoliosis or not. I've already told, but I would again re-emphasize that early detection is of paramount importance. Once you detect it early, you can stop it from progressing and you can stop it from getting any complications and thus avoiding surgery.